Maybe. Yeah, already I can tell this side has very little gland.
How you doing, brother?
Great.
Nice.
Thought about taking a nap.
You can rest that other arm by your side, okay?
Yes, sir.
Yeah.
Relax a little bit.
Yeah, lift that up a little bit.
Everything's going on purposely, okay?
Yep. All right. Give me a little room there. Good. Elbow straight a little bit if you can. Yeah, there you go.
Yeah.
So Dr. Lebowitz, can you explain a little bit the purpose of the cold or the wet towel? blood probe?
Sure. So Vaser is ultrasound energy. It actually, does heat, you know? And if I get this on his skin like that, I can cause a burn. And we don't want that. We want the stealth incisions. We want perfection. That's what we want. So me as a surgeon, I agonize, about what to do to make the best results and the best technique and no complications. I don't want any complications. This guy is from Texas. He's staying for 48 hours and he's out of here. So he can't afford to have any problems. He's got a home, family, he's got a job to get to. So I want in and out, They say surgeons should be like cat burglars. They should do their job and nobody knows. And so that's what I want. I want him to go back to work. Today is Thursday. He's going to be back to work in Texas on Monday and do his business. He's going to be home with his children on Saturday, is it?
Saturday evening.
Saturday evening. I want him to play with his children on Sunday. So we want the best results and the limited downtime. Sure, he's got to wear his compression vest and do some antibiotics and some medicines, but we want the best. So I agonize, about what I can do better. And, because I want my patients to be blown away with the results.
3 minutes, sir.
Got it. So here I am now, going through the scar tissue in his old incision. And I think the glands are gone on this side. Don't have to do much on this side.
So we hear Clarence giving you a heads up for the time. Can you just explain why that's important, especially for Vaser?
Perfect. So you don't want to overdo Vaser. Vaser, if you overdo it, you'll get burns, you'll get hardness, you'll get seromas, which is fluid collection from too much energy. So with my technique, I've literally perfected this to the time. So there's a certain amount of time I want to give per area. I don't want to underdo it and I don't want to overdo it. So I've selected to do 6 minutes on this port. 6 minutes on this port, a little less over here, because there's less gland and fibrosis than over here. And I'm going to do a little bit of the belly button to get the midline there.
Too much, sir.
I want my patients, again, to call me up, in a month after the surgery, say, Doc, unbelievable. And it's hot down in Texas,
He wants to take his shirt off at the beach,
He wants to play with his kids, without wearing a hoodie.
And just for the viewers, this is Vaser right now. So we're not actually doing the LipoSculpture until we finish the Vaser. And the point of the Vaser is to break down the fat. So you see Dr. Lebowitz, he's grabbing the gland and getting around it and over it and below it to break it up so that when he does the LipoSculpture, it comes out like butter.
Yeah. I got big responsibility here.
1 minute to your 6.
Got it.
Mm-hmm. How you doing, my good man?
Good.
Nice. 30 seconds, though.
I can handle that.
Someone's asking, they have unilateral gynecomastia. How can they contact you?
10 seconds.
Email me. Email me, JonathanLeibowitz.MD
And 6.
at gmail.com. What are we on, Instagram or YouTube?
We're on YouTube.
Yeah, email me, JonathanLeibowitz.MD at gmail.com. I will answer you that same day.
Yeah. Okay, man.
You all right?
Yes, sir.
Good. Hold on. This out. Good. All right. So now we're going to do 6 minutes over here. Now the sides didn't have any work done previously. Good. All ready? Here we go.
Just to reiterate that, Dr. Leibowitz, he will do free video consultations. You could reach out to him via Instagram. You can give a call at 631-424-0101, or you can email him at jonathanleibowitzmd at gmail.com, and he will answer
Everyone?
everyone ASAP.
Yeah. Right. You got to visualize what I'm doing. You got to visualize where the gland is and where the muscle is and where that space is, where you want that hockey stick look. So I'm diving here, very deep into, under the gland, but above the muscle. I got to be careful, Don't want to puncture a lung. Wasn't there somebody who just gave a steroid shot to somebody
Yeah, in football.
in football and they punctured the guy's lung?
Yeah,
Yeah, that's bad form.
I think he's gonna there's gonna be some lawsuit or something if he's.
Well, I don't know if it's a chance.
Steroid injections usually
It's a chance of that. There's a chance of that, but good doctors shouldn't do that.
Oh, yes, sir.
So I know where I am.
Yes, sir. That's nice.
This is all under local anesthesia. So the patient he's awake right now. We were talking about the Houston Astros and making fun of them a little bit.
Now.
They want to make fun of our Jets too.
Yeah. So now I'm going down to the lats. So I attack this area, each area at a time. So now I want to create the space between the lats, which is over here, and the pecs, which is over here. With me, it's not about, gland removal or the surrounding areas. With me, it's about everything. But again, I'm not for everybody. You know what I mean? With me, you get the Mercedes, you get the BMW, you get, some people are happy with, driving a Hyundai. Not anything bad about a Hyundai. It's a mode of transportation, but with me, you get the best. And guaranteed results. If you need a touch-up or want a touch-up, you call me. We wait about 8 months. Don't do it immediately because I want the results that I've done to show, And this is not like the end all. This guy needs to,
3 minutes, though.
take himself,
3 minutes.
yes, sir, to the next level. He needs to exercise and eat better.
Yes.
None of those Texas husk puppies, you know what I mean? He's got to exercise. He can't just you know, sit there and eat ice cream all day and, oh, I'm gonna have Lebo do a touch-up. No, don't do that to me.
That's why it's beyond gynecomastia, right?
It's beyond. You know, exercise, eat, work out. Right over here?
Yes, sir. 2 minutes, though.
Got it.
Great.
And what's great about this, guys, is because he's whittling down the gland so much through Vaser and Lipo, when he actually has to open up and cause an incision, it's so small and so hidden that you're not going to see much scarring afterwards.
What do I call it?
Where the
Stealth.
water stealth incisions, yeah,
Stealth incisions.
because
like a
the
ninja.
because the glands are going to be so small, right? So he doesn't have to make this huge incision. And when you recover, it's going to look like.
Got it there?
No, I was sorry I had a little cough.
Oh.
I apologize, sir.
Nah. Just want to make sure I don't want to hurt you.
No, you're doing great.
Does the scar at the bottom of the areola go away? If yes, how long does it take to disappear?
If no, it fades. Doesn't go away.
30 seconds. Sir.
You cut skin, there's a scar. But it heals amazingly. But if you don't want a scar there, you know, I hold no punches. Don't do the surgery, damn it. You know? Don't do it.
I would recommend, regarding the person who asked that question, I'd recommend looking at his post-op photos and
Yes.
see the results afterwards, and you can notice that the scar it's hidden.
Good. Yeah. It's hidden.
6'6".
Good. Okay. So we're gonna go 5 here. I may add another little 6
Okay.
here just to.
No worries.
Who knows?
Yeah.
Okay. So here we go. Now the 5 now.
17. Okay.
Yes, sir. All right. So here I am at the nipple again, protecting the nipple with the wet gauze. Okay. Again, I aggravate. You know, people, you know, think about what they're gonna eat for dinner, or this and that. I aggravate. How to make my surgeries better. How to make a better experience for my patients. I mean, I consulted somebody yesterday. He had surgery a couple years ago. Terrible results. Terrible. Like nothing. And I told him my price. And he said to me, rip off. I go, well, okay. I'm saying that about the surgeon who operated on you. That was a rip off. And now you're calling me up saying you're not happy with the results? Go back and bitch to that doctor. You know? And say, listen, you're a ripoff because you didn't do my job. I guarantee my results and I'm always available. You know? Yeah. But if Bernie Sanders, yeah, I mean, this is interesting. If Bernie Sanders would have been president, this surgery would have been free. You know, we should have Bernie Sanders. This surgery would have been free.
Is that called a pregnant pause?
What is that? What is that called?
Pregnant pause. Is
A pregnant pause?
that no comment, though.
Yeah. Damn it. All you guys who wanted the surgery should have voted for Bernie. Feel the burn. This would have been free if Bernie would have been president.
And education.
Oh, I love politics.
I know.
I love politics.
Sorry, I'm starting to laugh. I apologize, Mike.
It's all right.
Laughing is good. I like that.
Yeah, I think it was good.
Nice.
Are you laughing at the conversation or the tickle?
The tickle.
The
Oh, the
tickle,
tickle.
yeah.
I mean, in the middle of the conversation, too.
So those who ask if it hurts,
I don't know though, but you know, if Bernie was, you would have been working for free. If my surgery was for free, well, am I going to pay you?
Maybe.
Have to put a tip jar out front.
What's that?
Have to put a tip jar out front.
I got to put a tip jar out front.
Well, thank you, Mr. Patient.
Or, well, you remember what's that ice cream store that if you tip them, they start singing? What was that? It's called
Cold Stone.
Cold Stone. If you put it there, the workers are like in Dairy Queen. If they don't serve you upside down, you know it's free. You know.
They flip it, and if it falls, they give it to you for free.
Or if they don't flip it, they give it to you for free.
Yes.
And in Cold Stone, if you put in the tip jar, they're obligated to sing a song.
So, Doc, are you going to sing a song?
Clarence.
Never did that for me.
Clarence got the golden vocals.
I think it's Panda Express. I've only seen that in Panda Express.
You know what?
What were they saying?
They sing, or they ring a bell and they say thank you.
Yeah. Where in
Panda Express. It's like a
Panda Express?
it's like a Chinese restaurant chain.
Cold Stone got rid of my favorite flavor.
It was your favorite place?
No, they got rid of my favorite flavor ice cream.
Do they have Cold Stone anymore?
Yeah,
How you doing, man?
Great.
it was owned by me in Babylon.
What are the main causes of gyno? I've had it since I was 16.
Puberty. At 16, puberty.
Well, how old are they now?
How old are you now?
16 and a half.
Yep.
Unless you took, testosterone at 16.
2 minutes though.
Got it.
2 minutes. 17. Very comfortable, man.
Does the areola shrink after surgery?
Yes, sir. Good question. I like that question rather than how much.
It's a good question.
How much? Yeah. How about does the areola lose sensitivity? You know? The areola is a sex organ, man. You know? It's like a dog. You rub the dog's belly, he starts to, his tail wags. You know?
You're saying the belly's a sex organ for the dogs?
The belly is a sex organ for the dog. Yeah. They kind of go like this.
Oh.
Don't you have
10 seconds. 1 minute, 10 seconds.
So to answer that question, I've never got a complaint that there is numbness in the nipple. I mean, initially, yes. What do we have?
1 minute.
1 minute.
Mhm.
I may do an extra minute here
Okay.
on this side.
No worries.
But overall, the sensation, it comes back and
Overall, again, I've never had a complaint. Overall, I've never had a complaint that. Thank you, Kathy.
what's the biggest gland you've removed?
Oh, big as my head.
Big as your head?
Big as my head.
It's a big head.
That's a big head.
30 seconds to your 17.
We're gonna do one more minute, right?
Uh-huh. 118.
Yes, sir.
Is it painful?
Is it painful? Yeah, I'm such a mean guy. We're holding him down. We got a bullet.
Is it by the bullet already?
We got a bullet in his mouth.
That's back.
You can't see with the mask, but
Yeah.
no, it's not painful.
He's
Hey,
laughing.
he's laughing.
He's actually tickling.
You have the tickle spot.
Yeah, it's right there.
One more minute.
1 minute, yeah. Things going perfectly, man.
Hit this one more time.
Thank you.
That's it.
Is it safe to get gyno surgery done under local anesthesia? Well, Dr. Leibowitz
No, it's
only
not safe at all, man. It's not safe.
Dr. Leibowitz
Don't do it.
he only does it under local anesthesia. So
Don't do it.
30
if
Yeah.
Thank you.
if you're nervous about doing it under local anesthesia, you can. There's plenty of doctors that will do it under general.
But then you don't know what,
You don't know what's happening. You know.
what's happening.
At least here, the patient
To you, 18.
knows what's happening. We're communicating with the patient. He's
And
happy.
he
We're
knows,
happy.
He knows, so many people I've spoken
And
to,
that's it. 18.
the doctor, he says, well, the doctor was supposed to do this.
Perfect, my man.
And he woke up, he didn't do it, and the doctor's excuse was when the patient asked him, why didn't you do this? The doctor says, oh, it didn't need to be done. But then they call me up because they're not happy with that doctor's results.
After surgery, how much time do I need to get back to martial arts, like take body hits?
2 weeks at least for body hits. 2 weeks, maybe 3. I mean, I tell people, to go to the gym. It's 2 weeks afterwards, but they can do legs. Just no chest work for 2 weeks is kind of my rule.
24 is your target here, bro.
That's 5, right?
It's 6 over here.
Yeah, I know.
Michael, the question is yes.
So
The answer is
so
yes.
20, 18,
It's
19,
definitely
20,
recommended
22,
to
23.
lose weight before you get on the table. The more body fat you have, and it's gonna take a longer time. So definitely recommend if you're getting the surgery done to lose weight. It makes it
Yeah.
easier on you and makes it easier on the doctor.
Yeah, I mean, listen, if you weigh over 250, lose weight, man. It's more work for me, more work for you. Lose weight. You want it done right.
Did you know that in Africa, every 60 seconds a minute passes?
Yeah, I heard that. I just found out that my birthday was the day I was born. I just found that out.
That's pretty sneaky.
I'm curious if that's only in
I keep on
Africa.
trying to tell, CJ, I ask him all the time, who's buried in Grant's tomb?
What's that guy's name?
Grant.
That's what I thought.
So I asked CJ, who's buried in? He said, I don't know.
Sneaky. Love it, man. Love it.
In what situation do you use drains?
Big ass glands. Besides that, I mean, I'll put a drain in his belly, but I won't be putting a bulb in it. But I just want the fluid to kind of drain out. So I put like a straw. Call it a straw in the belly. Belly button.
Usual
Take it
duration.
out before he leaves.
3 minutes to your 23. Okay.
The usual duration. The patient comes in at 7:30, and we're done by 1,
Yeah,
1:30. So
he's out of here by 1:30.
6 hours in and out.
Yeah. Then Kathy, CJ, and me, we go to the gym.
Hey, that's right.
You should see Kathy. She benches 250.
Mighty might.
Is it recommended to lose weight before gyno surgery to avoid liposuction and just go with gland removal?
All right. Good question. The answer to that is if you need liposuction, you'll probably, and I'm not going to say definitely, I'm going to say probably will always need liposuction because, and hear me carefully, chest fat is a different type of fat. It's like, like a turkey. You have the white meat and the dark meat.
2 minutes.
We kind of like the dark meat, don't we? We have the light meat and we have the dark meat. The problem with chest fat, it's the different type of fat. It's like estrogen fat, all right? You're not going to lose it, man. You're not going to lose it. So if people say, oh, I want to lose weight so I don't need lipo, and I tell you you're gonna need lipo, you're gonna always, 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 should I say it again? Always need lipo. If you're not, it's resistant to diet and exercise.
It's definitely recommended to lose weight though,
Oh yeah.
because it'll, you know, it's easier for everyone when that happens. When you do
Easy
that.
for everybody. Yes, sir. What are we at?
1 minute and 20 seconds to go to
Nine.
23.
Yeah, it's always, always, always. But yeah, you'll.
It's the noise, right?
Estrogen fat is resistant to diet and exercise. Now, not to say that you know, you go on a starvation diet and this and that, you know, so I'll never, you know, like who's buried in Grant's tomb, unless I dig him up, I'll never know.
Can liposuction only treat gyno?
No, you can treat, you know, for body contour, like here, I'm contouring. This is not gyno.
1 minute to 23.
Good. This is not gyno down here, but this is my extended gyno. Because I want to, again, blow people away with results. I don't want them to just be flat here and have big old, you know, big belly and big lats and side boob and stuff. So I've taken it to the next level.
Nice.
You all right?
Yes, sir.
Tickling you?
Yes, sir.
30 seconds to your 23.
I can handle that.
Oh, yeah. Thank you.
A minute or 2 minutes. By the belly, going up and around, and we'll stop the lipo. We'll start the lipo, which is the fun part. This is not the fun part, guys. This is boring.
Would you recommend cool sculpting to freeze off chest fat and then go with gland removal to avoid liposuction?
I recommend never do cool sculpting. Save your money. This is it, man.
23.
This is it. You do this. You don't do cool sculpting, please. That's for doctors to just kind of rip off patients. Or maybe you have a tiny area, a teeny tiny area you want to treat. But you know, this is it. If you're gonna do it, man. Give me, what are we at? 23?
23, yes.
24, like a minute or so. A minute to 2 minutes. Give me in a minute. Or give me 30 seconds.
So in a bit, guys, we're actually gonna
30 seconds.
jump over to Instagram Live and continue with the surgery. So if you guys wanna
Give me a minute. Give me 30 seconds, yeah.
stick with the patient and go through the journey with him, then jump over to Instagram Live, and you'll watch the lipo, sculpture, and eventually ending with the fat grafting.
10 seconds to your 30 seconds. 30 seconds.
Give me 30 seconds. Mo?
Oh,
Oh. Everybody good?
yeah.
Kathy, what's going on?
We're doing
Let's give some
liposuction.
Kathy time.
Hmm.
Let's give Kathy time here.
That's right.
Doc, how can
no,
I?
let's give Kathy time. So
All
what's
right,
going
we'll
on?
wait on the question. How can I convince
What
my?
are you doing this weekend, Kathy?
Don't know.
Gonna go to,
Another 30 seconds here.
I passed by Home Goods the other day.
10 seconds
I haven't
to
been
your
in
30
them for a
seconds.
while. There's football on Saturday.
What's that, 30 seconds?
We have football on Sunday.
Got football?
30 seconds.
Are you playing?
This your second 30 seconds?
My son
Yes.
plays flag.
Are you playing? Do you get in there?
No, I'm just a cheerleader.
Yeah. What's flag? Do they have a flag by their butt and you have to pull it?
It's around the waist. There's multiple plastic pieces.
And if you pull it,
You have to
they're
pull it in.
They're down,
and
yeah.
and they're down. So it's no tackle.
No tackle, but people go down all the
Yeah, they go
time.
down all the time.
Yeah.
That's me. I would slip.
No, that's not slipping, you know, I mean, you're really,
And
you're
your
really
second
like
30
reaching
seconds.
for the
Down
ball.
toward
and
25.
Yep.
You're down.
25.1.
So we did 2 minutes. We did. Wait, what do we do?
You did 30 seconds, 30 seconds.
You did
and
two
then
sets of 30 seconds
30
on each
seconds.
side.
Oh, so we only did.
So you did a minute per side.
You did
On the belly.
23.
We did 2 minutes in the belly button.
Total, yeah.
Okay.
Yeah.
Okay. You can do 25 and a half. Okay. Good. So I was gonna do another minute, but I don't want to do. I can do another minute. Make it easy for everybody. Make it easy.
Doc, how can I convince my primary doctor I have gyno? I
Why
clearly,
are you convincing your freaking primary doctor you have gyno?
I clearly have
I
gyno.
know
Have
why
it for
you're
10
asking.
years.
I know why you're asking.
Any recommendations?
It's not your primary doctor, but I know why you're asking.
You're doing another minute here.
Why is he asking, Kathy? Why is he asking if you have convinced? Why is he asking? I know why.
If you're
Give me 30
asking, you
seconds.
have it, then you have. time.
Right, but why is he asking his
That's your
freaking
30 seconds.
primary doctor to do 30 seconds?
Perfect.
Because he wants to see if he can put us through fucking
Oh, no,
insurance.
insurance.
They'll-
That's why.
They will never cover it.
Never.
That's why. Because you want to put us through fucking insurance, and it won't work. All right?
You get this.
Sorry for the four-letter word. Please. But again, if Bernie Sanders would be president, it would be free. Oh, I'm such an ass sometimes.
What BMI? Someone asked about minimum
Maybe
weight. So
Convince your mom or your grandma. Maybe she'll pay for it. What BMI?
yeah, someone asked for the minimum weight. So it's good to.
Darren, what's the BMI for this?
10 seconds to your 30, okay?
What's the maximum BMI about for the surgery, Darren?
And
What?
Probably like 3.
30
3?
27,
Yeah, about that.
27.
Yeah, what's that? We're
You're
done?
on your 30 seconds. You're done.
Oh, we're done?
Yeah.
Okay, fuck. I gotta get back 5 minutes now. No.
Rachel, it's actually
Yeah.
not painful at all. The patient's
TMI in the high 20s.
patient's hanging out.
Yeah.
He's giving a thumbs
Who's
up
that,
right now.
Rachel? Rachel?
Rachel.
Rachel! Hi, Rachel.
It's not painful at all. Patient laughed. He said it tickles.
I've laughed through probably half of this.
I've laughed, I've cried. How do I convince my primary care physician? Please.
Because I'm like,
Pay your $10 copay.
Yo, patient. If
Pay your
kid,
$10 copay.
yo, patient.
I don't
If
think there's
kidnapped, blink
$10
twice.
copays anymore, are there? No.
That's funny.
Now there's like
where?
now there's like $5,000 deductibles.
Yes.
There's no $10 copays no more.
Thank you, my friend.
It's $5,000 deductible. I've got like a $20,000 deductible in my policy.
Aw.
What?
Someone's asking how much you weigh coming into this.
How much I like?
Yeah.
215, 220.
215, 220. So
Yeah, I mean, he's a big boy,
yeah,
you know?
but he's gonna look great after this.
Yeah.
Oh, absolutely. Taking shape right now.
Darren, put this up.
You guys actually can see already. He's you can see it
Yeah, put those up
working
into
so
the-
far, and he didn't. Dr. Lebowitz didn't even start the lipo yet. So
So let me answer that insurance question. It's not covered, okay? It's not. Insurance is a Ponzi scam. Do you know what a Ponzi scam is? It's a Ponzi scam. You pay them so that the fat cats can get rich and you get nothing. There's deductibles and there's this, and then you gotta prove that it's like, you know, it's ruining your life. Oh, I'm psychologically, you know, traumatized, this and that. Well, they'll say, take drugs. That's what they'll say. Take drugs. They'll say, they may buy you a gym membership, you know, actually. They might, actually, insurance companies do.
really,
Yeah, yeah. Some of them do.
they pay monthly.
I can't swear on that. But it's not covered, man. It's not. All right, are we done? So let's get this suction. Guys, get this out of the way.
Excuse me.
Get a local.
So for you guys that still have questions, we're gonna jump to Instagram Live in about 10, 15 minutes, 20 minutes. So hold those questions and ask them when we're on Instagram Live. Hope to see you guys soon.